Welcome to The Explainer. Today, we are jumping straight in to unpack the hidden layers of clinical practice. We're going to see how human culture fundamentally shapes modern therapy and really our psychology as a whole. Let's think about this for a second. If you break a bone in New York, Tokyo, or a rural village in India, a broken bone is a broken bone, right? The physical reality is identical. But is psychiatric illness exactly the same across the globe? It's so easy to just assume that mental health conditions look universally identical. But as we're about to see, that assumption misses a massive piece of the human experience. Section 1. The Universal Myth. Assuming Western psychiatry applies to everyone. You see, for the longest time, modern medicine carried a pretty significant flaw. It treated mental illness identically everywhere, exactly like that physical broken bone we just talked about. Back in 1977, a psychiatrist and anthropologist named Arthur Kleinman actually coined a term for this. He called it the category fallacy. This happens when a diagnostic category developed in one highly specific cultural context is just assumed to be a natural, universal reality. It's then applied everywhere else with absolutely no validation. Kleinman basically argued that by applying American diagnostic criteria globally, psychiatrists were systematically missing the genuine suffering of non-Western patients. To put that into perspective, look at this famous field study from Taiwan. Researchers there made a wild discovery. A staggering 87% of Chinese patients who were diagnosed with neurasthenia, which translates roughly to a kind of physical nervous exhaustion, actually met the full Western criteria for major depression. The underlying illness was there for sure, but the presentation was entirely different. Section 2. Culture shapes our symptoms. The East versus West divide. It turns out, culture actively dictates the language people use to express their psychological pain. In Eastern cultures, places like India, China, or Japan, patients often present with somatic or physical symptoms. They'll talk about intense fatigue, body aches, headaches, or dizziness. And there's a reason for that. In these cultures, using emotional language carries way too much risk or social stigma. On the flip side, Western patients are far more likely to express psychological symptoms. They'll just directly verbalize feelings of guilt, sadness, worthlessness, or despair. So the underlying distress might be very similar, but the cultural translation, totally different. This leads us to these really fascinating, highly specific conditions known as culture-bound syndromes. Take DOT syndrome in India, for example. This condition involves severe clinical anxiety and depression, but it's entirely centered around a cultural belief that the loss of semen causes profound physical weakness and energy depletion. Depending on the culture you're in, these idioms of distress deeply impact what you do next. Does a patient go to a hospital first, or do they visit a faith healer, or maybe an Ayurvedic doctor? It also dictates the treatment models themselves. Eastern systems usually involve the whole family in medical decisions, whereas Western systems are highly individual-centered. Section 3. AI and Western bias, the problem with modern tech in mental health. Now, you might be wondering, can artificial intelligence solve these cultural disconnects, or does it just inherit our own blind spots? Well, to understand AI's limitations, we have to look at its training data. Most psychological research and the data used to train modern AI models comes from weird populations. And by weird, I mean Western, educated, industrialized, rich, and democratic. That is an incredibly specific and, frankly, unrepresentative slice of the global population. Researchers recently tested large language models using diverse patient personas, and the split in performance is fascinating. When it comes to purely diagnostic decisions, the AI actually shows minimal racial bias. It can spot the symptoms just fine. But when asked for treatment recommendations, the models degraded heavily. They literally suggested inferior treatment options when the patient was explicitly or implicitly identified as Black. So AI models might be super intelligent at processing data, but they lack cultural wisdom. They're simply mirroring the systemic biases already hidden inside their training data. Section 4. Beneath the surface, moving past the tip of the iceberg. Relying purely on data or just looking at what's immediately visible in front of you is never enough in clinical psychology. And that's because clinicians face what we call the psychological iceberg. The overt symptoms and behaviors, the panic attacks, the lack of sleep, that's just the visible tip of the iceberg. Beneath the surface is this massive, complex structure. You've got biology and neurotransmitters, deeply ingrained personality traits, childhood trauma, and the entire cultural context and family dynamic. If a clinician only treats the tip of the iceberg based on some diagnostic code, they completely miss the actual human being sitting across from them. Now, institutional psychiatry is actively trying to adapt to this. The modern diagnostic manual, the DSM-5, now includes a tool called the Cultural Formulation Interview, or CFI. It's specifically designed to surface those hidden stressors lurking beneath the waterline, things like housing instability, migration trauma, and systemic discrimination. It gives clinicians a structured way to actually capture that vital contextual information.
Section 5. The Human Clinical Toolkit. Skills and AI simply cannot replicate.
So, what does it actually take to be an effective, holistic psychologist today? We've seen the limitations of AI, and we know rigid textbooks fall short. It really takes a specific blend of ingredients that separate a human professional from, say, a well-read chatbot. First up, science. You absolutely need evidence-based knowledge, no way around it. Second, curiosity. You need a genuine, lifelong willingness to learn, because human behavior is always evolving. Third is compassion, caring deeply, not just for the patient, but for the field itself. And finally, critical thinking, the ability to look right past the textbook and solve unique, messy human problems. Because honestly, if you have the science but lack the curiosity and compassion, you're really no different than a machine. There's this vital rule in therapy. Observe, do not interpret. Think of it like looking at a famous painting, like Van Gogh's Starry Night. If you immediately try to interpret what the stars mean, you completely miss the act of simply observing the colors, the spirals, the sky itself. It's the same in therapy. If a clinician rushes to interpret a symptom just to fit it neatly into a diagnosis, they lose out on observing the patient's reality in the present moment. And this is exactly why the best clinical minds borrow from entirely different fields. They have to, just to grasp the sheer complexity of the human experience. Art teaches us how to observe without immediately judging or interpreting. Literature, both fiction and nonfiction, builds our capacity for empathy. It helps us understand complex human narratives like grief and loneliness way better than any clinical manual ever could. And law? Well, law provides the ethical boundaries, the rules, and the rights necessary to safely navigate this whole space. When we put this all together, the divide becomes incredibly clear. AI is absolutely fantastic at summarizing data, doing initial health screenings, and churning out documented notes. But human capabilities, those are irreplaceable. Building a trusting therapeutic alliance, navigating those murky gray areas of ethical decision-making, and applying nuanced clinical judgment, doing all of that requires a human heart and a multidisciplinary mind. Which leaves us with a final, pretty provocative thought to take away from all of this. As our world gets more connected and our technology gets more and more advanced, can an algorithm ever truly understand human culture? It's definitely something to think deeply about as we navigate the future of mental health. Thank you so much for joining me on this explainer. Keep learning, and I'll see you next time.